Okay. All right. So we decided that we thought it'd be really important to share with you this valuable information that we've all learned along the way about how to safely run any facility in this new world of COVID. Of course, Dr. Ballum and Ms. Wirtz were very integral in ensuring that our hospital was safe to welcome and care for our patients throughout this crisis and currently. And so we had to be very astute and aware of all of the practices that would be effective in ensuring the safety of our patients and, of course, our staff as well. So as faith communities begin to gather again and start to plan to gather again, we want to make all of this information available to you as well. I know many of you are probably in the throes of creating your own strategies for how you will reopen, and all of your houses of worship may look different and have different memberships and numbers of congregation and size of your house of worship. So we want to make sure we are able to provide for you enough food for thought, so as you create your plan, it's tailored and customized for the needs of your congregation and to protect you and your staff, as well as the people that will be visiting the houses of worship and I know are so anxious to come back. So we want to give you some of our best practices, the insights that we've learned, and share those with you as you develop your comprehensive approach to welcoming back your visitors. So we thought it appropriate, of course, to start with an understanding of what to look out for, because, you know, we think about preparing the facility, but we're also going to be welcoming people into the houses of worship that could be demonstrating or presenting with certain symptoms. So we want you to know what to look out for and how to properly screen, because as you're welcoming people in, you want to be mindful and have your staff be mindful of things to be looking out for, so that no one's entering the sanctuary that is exhibiting symptoms of the virus. So at this point, I'm going to turn it over to the expert, Dr. Ballum, who could give you a little bit more insight about the screening process and recognizing signs and symptoms of COVID.
Hi, good evening, everyone. I'm Dr. Naveen Ballum. I want to emphasize a couple of things that Desiree said. I think really preparing for opening up is a team effort. I think everything that we witnessed and did at Claremas, it was no individual. It was really everybody working together. I think communication is very important. So putting out communication to everybody that's going to be attending any service at your facility, as well as at the church, as well as to kind of review everything that happened and then have a debriefing at the end to see what was done well, what could be done better. These are the kinds of things that I think were very critical for us. You know, even from the onset of COVID till currently, it's very important to understand what the symptoms of COVID are, so you know what to look out for. Every single person that enters the facility at Claremas and any RWJ hospital, we do a symptom screening questionnaire at the entrance, as well as a temperature check. And we basically ask them if they have symptoms of fever, chills, cough, shortness of breath, difficulty breathing, fatigue, muscle aches, headaches. I think you're going to get a copy of this from Desiree, so I won't go through all of these, but it's very important to know if patients are suffering from these. Most of these sound like your common flu symptoms, and that's exactly what they are. But because COVID is currently in a pandemic, our awareness has to be very high and look for consider coronavirus as opposed to your common flu that we normally see. From exposure to the onset of symptoms can be anywhere from 2 to 14 days. So we also ask anybody that enters our facilities if they've had exposure to a COVID patient or who they believe is COVID in the last 2 weeks. And if they do, then we take extra precautions or try to avoid them coming into our facility, because the last thing you need is the spread of the disease. Next slide, Desiree. So one of the things that we learned is, other than the symptoms of COVID, is who's really at risk for developing this. Obviously, there has been no consistent path We've seen people, as you know, we've seen newborns with COVID, and we've seen people in their 80s and 90s with COVID. And I can tell you, I've personally seen the full spectrum. I've seen physicians who are in their 70s get COVID and not have one symptom, but then test positive, and been what we call the walking well. So they've picked it up somewhere along the way, but they never exhibited any of those symptoms. So, you know, in theory, what happens is when you're presenting with those symptoms, you're theoretically shedding the virus, and you're more vulnerable to spread the virus. So those are important things to know about the symptoms of the virus. But these are, in general, the risk factors that make somebody more susceptible to having a poor outcome with coronavirus. We've seen patients that are asthmatic or have any sort of lung conditions, kidney conditions, even as simple as hypertension, chronic lung disease, diabetes, hemoglobin disorders, any sort of blood dyscrasias, patients that are immunocompromised, cancer patients, because their body doesn't have the ability to fight off the virus, liver disease. Older patients typically suffer poor outcomes. People in nursing homes, long-term care facilities, heart condition, and obesity. One of the things that came out in the literature is that people that are overweight carry a certain type of receptor on their cells that make them more susceptible to catching COVID, and then also suffering from poor outcomes from COVID. And we don't know if that's entirely just from the weight, or if it's because of the weight and all the other medical issues that are related to being overweight, such as kidney disease, hypertension, diabetes, etc. So, you know, when you're looking to open up your churches, one of the biggest things I would be concerned about is protecting your vulnerable population. If you know patients suffer from a lot of medical issues, I think it's very important to communicate to them that at least early on, until we understand what the impact of opening and bringing people together is, that maybe they should, you know, refrain early on. And then as the science develops and we understand more, and at that point you can consider bringing them back. Maybe do virtual, have them participate virtually early on, and then over time, you know, allow them to come in. But it's all about communication, letting people know what the science is, what they can do to protect themselves, and then obviously we're all adults and we make our own decisions. But at least if you're informed, then you can make a good decision. So, you know, some of the things that we've really learned through this pandemic, and that we're trying to emphasize, God forbid that there's a second wave, is really go and see your primary care doctor. I think having good communication and an appointment with them, mainly to take any medical issues you have and really control them. You don't want diabetes with hemoglobin A1Cs and sugar levels that are very high and uncontrolled, because that puts you at a higher risk. So what we recommend is to see your physician, as well as get medications, you know, at least 2 to 4 weeks supply, so you don't run out if there is another pandemic that occurs. Vaccinations are also very important. If you haven't been vaccinated for the flu this year, you know, or moving into next year, that's something to definitely consider. And then, you know, I think what was most disturbing to us, we focused so much on COVID and the implications of COVID, we forgot about all the other regular medical issues. You know, during this pandemic throughout the country, there were 50% less heart attacks in the country. I mean, that's 50% less people coming to the hospital with a heart attack. We know that this disease doesn't disappear. The problem is people were so afraid to come to the hospital because of COVID that they were having heart attacks at home. So it's very important that you should not delay any medical care that you need, because all of our facilities at RWJ, we've been able to find ways to safely treat patients with COVID and patients that don't have COVID. So we literally test every single person that comes into the hospital, and we're able to treat them in separate areas and really minimize cross-contamination and the risk of, you know, patients without COVID catching it. And that's also, you know, I would recommend that also for your churches, is that I would recommend the screening questionnaire when worshipers are coming into your facilities. I would recommend doing the temperature checks. At RWJ, we do, for elective surgeries, we test every patient for COVID. I don't know how realistic that is for every church on during every religious session to get somebody tested. I think that's probably impractical, because we know that even if you test somebody today and you get the results in, let's say, 48, 72 hours, if they had an exposure after the test was done, and then they still come to church or to the hospital, there's still some risk. So I think that the goal is to really try to create processes where you can protect worshipers in the best possible way. And the last thing of that is if there's any concern or you worry that you might have exposure, really get medical care early. One of the other things that we learned, identifying and treating COVID as early as possible really lends itself to having a better outcome. So I think getting healthcare attention early, if you do feel like you have the signs and symptoms of COVID, I think is very important. This is a list of some of the other things that we see: the persistent pain in your chest, trouble breathing. When all of this started, I bought from Amazon these little finger pulse oximeters. You can even test your own oxygen levels at home. They're like $10 on Amazon. It's incredible what you can buy on Amazon. And if your pulse oxygen level falls below 90%, that's worrisome. Most of us run well above 90%. So that's a way to test your breathing. But clinically, you can see by looking at somebody, if your face is starting to turn blue, your lips are blue, it's also worrisome. Like it says here, call 911, call your medical doctors, and get medical care if you feel like you've been exposed and have symptoms. Intensifying cleaning. I think this is Anne Marie's specialty, so I will let her speak.
Excellent. Thank you, Dr. Balam. Hi, everybody. So really, when you're bringing people back into your facilities for worship, it's so important that you protect them to the best of your abilities. And that is, there's a high level of cleaning and disinfecting, and we all clean our facilities, but now we have to be even more vigilant about what we do and when we do it. And it may create times when we have to alter our processes, we have to alter our service times so that we can allow enough time in between for cleaning and taking care of things. We want to try to avoid using things that we can't really disinfect or clean, such as paper. Paper is a big issue with not being able to clean it. So any hymnals, missalettes, books that are going to be touched by more than one person, we might want to think about removing all of them. We were talking about if you want to use a sheet that has things printed on it that people can take with them. But as we all know, a lot of people don't take these things with them. They read them, they look at them, and then they leave them behind. So we have to then look at who's going to pick up those papers, who's going to go behind and make sure that those aren't being used to transmit things from people to people. Providing adequate ventilation, fresh air is a beautiful thing. Pushing air around when you're dealing with things like COVID, which have droplets in them, not the best idea. So if we have large fans going, any droplets that are in the air that might be carrying the virus will get pushed around further from person to person if you have large fans going. So while central air or very high, ceiling fans are okay, having fans that are down on the ground are not going to be advantageous for you and actually could create a problem there. If no one's been in your building for a very long time, for these few months, you need to flush the water through. Water that's been standing can carry with it a whole host of other things having absolutely nothing to do with COVID, but things like Legionella can be in the water systems that are stagnant for a while, and then when you start that water up again, it can transmit that which can cause Legionnaire's disease. So we want to make sure that you're flushing out your water systems. And as I said, allowing time for cleanups between your services. If you have one service a day, then you have plenty of time to clean. But if you're in a church or a house of worship that has more than one service, you need time in between to surfaces, the railings, any kind of pews that people were sitting in, the doorknobs, any high touch areas. So we want to make sure that we have a process in place, and it's hard. It's adding more people that we need to bring in to do these things. But this is how we're going to keep everyone safe, because it's so important that we take that responsibility. So there are lists, the EPA has lists out. There are lists of disinfectants that can be used against SARS-CoV. They produce, I think Desiree has it attached here. You can read the bottles that say you want to find products that actually meet this criteria, because not everything does kill virus particles. So you want to make sure that you're using the proper solutions. And as I said, I think Desiree has the list that you can attach, and you can look up the criteria there. We can move on, Desiree, if you want
to provide this deck to anyone who's interested, and all of these hyperlinks will take you directly to the EPA's list of suitable disinfectants, and it will also take you directly to the verification page where you can enter the EPA number of any sanitization product that you might have to see if it's suitable for fighting COVID.
And things that we're very in tune to at the hospital are things like dwell time and dry time. So when you're using a disinfectant product, it's not just important to spray it on and then wipe it down or walk away. There's actually times that you need to leave that wet, and it's called the dwell time. And so you need to spray your product or wipe down your product and actually leave it wet in order for it to kill the virus particles. So a lot of times people will spray things and then just wipe it right off, and that didn't necessarily leave enough time to kill the virus particles. And all of the products do usually say what their wet time is, how long you need to keep your items wet with the product. It says contact time. So those are the contact times that it actually needs to stay wet in order to break virus particles, to kill the virus.
Yeah, so when you're verifying the products that you have, that list that Anne-Marie just mentioned right here, which says contact time, it's the fifth row over. That will let you know how long you need to let that product sit before removing it or wiping it, and to consider it having done its job.
And also you have to keep in mind that we need to keep our people that are cleaning safe as well. So we want to make sure there's adequate ventilation when people are using cleaning products. All those cleaning products always say don't use them in an enclosed small rooms. So we want to be careful that we're looking at those as well to keep the safety of our workers as well. People that are cleaning our facilities, I don't know about your houses of worship, but at mine we have volunteers that clean. So they're volunteering to clean the facility. May not necessarily have the proper protective equipment, and the PPE stands for personal protective equipment. So they may not have the proper equipment, gloves or a mask, may not know how to use them properly. So we want to make sure that we explain to people how to use gloves. Gloves are they're great. They're meant to protect you from things, but they're also an avenue for spreading viruses around. One of the reasons why the CDC doesn't recommend people wearing gloves when they go out to the food store or when they go out places, because if you don't use gloves appropriately and you don't change them often enough, they can actually transmit the virus from your gloves and actually be a route of infection as well. So we want to make sure that our staff that are doing the cleaning know how to properly put on their gloves, take off their gloves, when to take them off, make sure that they're wearing masks when working with the chemicals, because aside from COVID, we don't want anyone succumbing to inhaling any kind of cleaning product that they're using. We want to make sure that we always keep all cleaning products away where children can get at them so that they don't have an issue. And then you're going to have to clean and disinfect your frequently touched surfaces. So shared objects, the recommendation is to clean between use, and shared objects are also shared surfaces that you touch. So the pews, those are shared surfaces that people will be touching. Anything that's shared. We come high touch things like doorknobs, pushing the push bars when you're pushing in to enter a door. Things like that are all high touch surfaces that are going to require more frequent cleaning. And as I said earlier, then that may necessitate increasing the time between services. You may have to allow extra time between services in order to clean those areas to keep everyone safe. So proper sanitizing of things, consider, you may want to project hymns or scripture readings. If you have a projector where you can project them so that you don't have to have a booklet that really cannot be cleaned well, or a piece of paper that we know people may hold, sneeze on, and then leave in the pew accidentally. So we want to make sure that we have other ways of doing this and thinking outside the box, projecting things up on a screen for everyone to read where they don't have to have an individual thing. Avoid, as I said, distributing the paper and the shared materials because they really can't be cleaned. Have sufficient people that are cleaning in between services, again, and so much easier said than done. But we know that trying to protect everyone isn't always easy, but it's the right thing to do. And we did. And then bathrooms. Bathrooms are a big concern as well. They're a shared area. They're an area that's not easy to control. You're not in the bathroom with people when they're in there, so we don't know what they've touched, where they've been, what they've used. So limiting bathroom usage may be an option. You may want to close your bathrooms for services and say that the bathrooms are only open in case of an emergency, and have someone that can open the bathroom if there is an emergency, so that you can then see, make sure that it's properly cleaned in between use. These are areas that have a lot of touch surfaces that will need to be cleaned. So we want to make sure that we're thinking of all of this. We were talking about entering the facility. When we talk about the number of people that are allowed into your facilities at a time. And Desiree, I don't know if we go through that later on probably, but we want to make sure that if you have 6 doors where people can enter, how do you then control the number of people that are coming in? You may have to close 5 of those 6 doors and everyone enters through 1 door so we can keep account of how many people are coming into the facility. Also cuts down on the amount of doors you have to clean, because if they're all coming in through 1 door, then you know that that's the 1 door that we really need to maintain. And then, as I said about water maintenance, really important if your facility hasn't been used, to make sure that that person that's running that water in the beginning should be wearing a mask to run that water, run the water through, run the cold water first, and then run the hot water. Make sure that you just run the water for a few minutes. We recommend, like 5 to 10 minutes, just run the water so that you can ensure that any bacteria that had built up during that time that it wasn't in use can then be flushed through the system. Yeah, and water, I was just reading, water fountains, probably best to maybe cover them up, cardboard, a little tape, something just says, do not use. Water fountains to begin with are big germ transmitters. So we want, especially in this time, we want to make sure that we're not using shared water fountains. And then your heating and ventilation systems. We always recommend that you change HVAC filters. Want to make sure, maybe bring someone in your company in to just make sure to see how your filters are. They filter the air that's going through. So you want to make sure that that air that's filtering through is clean. And as I said, avoid standing fans because they just blow any droplets around. And we want to make sure that that's not what we're doing. And then you can open your doors and windows. Open your windows are great. Fresh air is always good. And healthy hygiene. We want to make sure that everyone is washing their hands, maintain good hand hygiene. You can have hand sanitizer at the entrance for congregants to hand sanitize. The hand sanitizer should have at least a 60% alcohol concentration. There are no-touch hand sanitizers that you can get. You can put it on the wall and they work. They're battery operated. You wave your hand underneath it and the hand sanitizer comes out. Those are very good because then people aren't touching the top of a hand sanitizer bottle. Always good to have a lot of hand sanitizer around and to encourage people to sanitize their hands frequently with the hand sanitizer. We always want to make sure we're covering our coughs and sneezes. Everyone should be masked. I do know, I have seen people that when they go to sneeze, take the mask off so that they don't sneeze in their own mask while then just spraying their sneeze towards everyone else. So we want to encourage that we leave our masks on when we sneeze, and we can still throw that elbow up because it's always a good thing to remember. Elbow sneezing in the elbow is always good. I do that with my mask on and then I laugh at myself because I'm like, okay, but that's double the protection in my opinion, so it's good. But you can encourage your congregants to bring their own hand sanitizer with them to use, and then provide hand sanitizer for anybody that doesn't have their hand sanitizer to use. Supplies, as we have noticed throughout this whole event, very difficult even for us as a hospital system to get these supplies. So I understand that it is not easy, but you can get them now, and it's starting to open up more where these things are more readily available to you. So face coverings are the thing. These are the new norm. We need to wear face coverings, and people will ask very often, what kind of face covering should I wear? From the very beginning, the CDC was even saying that bandanas are acceptable forms of face covering. Anything that you have that's covering your face, it's a protection from what you are sending out into the world, and also a protection of what's coming to you. And when you have that double barrier, when you're wearing something and the person next to you is wearing something, you have a double barrier between those droplets that could be getting out. So you want to make sure, however, that you're not wearing a face covering that inhibits or restricts your breathing in any way, shape, or form. I've seen people with things so tight to their faces, I wonder how they're even taking a breath through them. That's not necessary. They say that the most important thing is the weave of the materials. So things that have a very tight weave actually provide very good coverage. Cotton has a tighter weave, so things that are cotton are very good. It's also, people are making homemade masks, and we were very, very lucky at the hospital. We have a community that was so loving and so giving, and people were sewing masks and donating them to the hospital. And these masks ranged from single layer to double layer masks that had a gap in between them that you could put a coffee filter in. A coffee filter inside two pieces of material actually creates an incredible barrier. It's almost as effective as the barriers, the N95 masks that we wear in the hospital ourselves. So you may have people in your congregation that want to do something and want to help, and maybe excellent sewers that can sew masks for people that need them. The most important thing about the masks is that they cover your mouth and your nose. We know that mucous membranes are located in both your mouth and your nose, so we want to make sure that both of those things are covered. I'm very talky with my hands too, sorry. Both of those things are covered by your mask when you're wearing the mask. And children under 2 years old should not be wearing masks. And they, washing your hands, washing your mask. So if you're wearing a mask, you want to make sure that you're washing that mask and that we're not wearing it every day all the time, taking it off, holding the front of it, and just continuing to wear it without washing it. But it is very important that everyone wear a mask. And then promoting that social distancing. So this is the other thing, you know, we want to come together as a congregation and be together. And it is still very possible to be together and apart. We talk about that in our family. We say, you know, we're apart, but we're together. So even though we may have to sit 6 feet apart, we're still together and we're still part of that congregation. So the capacities right now that are capped at 25% of the building capacity or 50 people, and that's whichever is lower. And I think that that's an important thing to note, because if you have, you know, 1,000-seat facility, you still can only have 50 people in that facility right now because it's the number that's lower. You want to make sure that while family groups can sit together, and they're perfectly fine to sit in a pew, the family grouping, that family group then needs to be socially distant from the next family group or the next individual. So that may mean capping off, closing off every other pew, and even staggering. If you're sitting in the right side of a pew, leave the next pew empty and then sit the next family on the left side of the next pew. That gives a very big, a very nice gap between the family groupings or the individual people. So we want to make sure that we are really cognizant of that distance. It's not just 6 feet in one direction, it's 6 feet in all directions. And we're still together even though we're apart. Now, there is the 100 people permitted at outdoor gatherings. So if you're having outdoor services, you have a little more leeway. You can have more people out there. You do want to make sure, however, that you're still that 6 feet around. And then eventually, hopefully, if we all behave ourselves in New Jersey, we can then get up to 250 people outside on June 22nd, and then, woo, 500 by July 3rd. But we all have to be very good. And then again, we at the hospital, as well as we see it everywhere in every food store that you go to, there's lines on the floors that say stand here, go here. You can be 6 feet apart. For those people that say, oh, I didn't know what 6 feet was, well, we can line it up for you on the lines. We can make lines. One-way route, so if you're going down an aisle in one direction, you can go up an aisle in a different direction, so that you don't have people crossing face to face, going in two different directions. And as I said earlier, you might want to designate that one door where you can monitor the people that are coming into the facility, and you can count them, so that you're not having the problem with 4 doors and everybody let 50 people in their one door, and then you end up with 200 people when you're only supposed to have 50. So you can limit the access. You can post lovely signs for people and say, you know, it's very important, as Dr. Ballum stressed, communication is so important with your congregation, ensuring that the message is that, yes, we're together, but we have to do it the right way. Yes, we're apart, but we can still be together. Letting people know that we're following the rules to keep you safe, to keep everyone safe. And, you know, there may be, we all know that the elderly population with having very, very strong faith are going to be the first people that want to rush back to your facilities. And those are also the people that are most at risk when they do return to your facility. So we want to make sure that we are keeping our whole population safe when they do return.
Just to mention, Anne-Marie, so when you do receive this deck, that where it says post signage and physical indicators, that's a hyperlink to the CDC webpage. They have pre-made signage so that you don't have to think about the wording or how to create your own signage. They have things that you can download and print and post already made for you to post in your house of worship.
Again, we mentioned keeping consistent with temporarily limiting the sharing of frequently touched objects. As far as collection goes, we don't want to be passing things around hand to people. So maybe there's a collection box or electronic methods for collecting these contributions. Handshake of peace, maybe a wave, maybe a smile. We do air hugs at work. When I see people in the work, we put our hands up and we say hi. Some other form to let people know that we're together. You know, we make hearts in our family. We Zoom every day and we all make hearts and we say, I love you. I can't hug you right now, but I love you. Things that there's not just a handshake, doesn't have to just mean peace or love. We can express those things. For people that are huggers like me, it's been painful not being able to hug and grasp and have that touch. But I have faith that it will come soon, and I just look at it as we are helping each other. And then food sharing, again, we have gone even at our hospital to prepackaged options of food, no buffets, things like that. We don't have people serving themselves. So we want to really make sure that everything we do is individualized and allows for the least amount of cross-contamination possible. And then just some suggestions, as we said, and I love this, it kind of wraps up all the things and reminds me if we've forgotten anything, but you can project your hymns to be read or sung. Hand sanitizer, we want to make sure that that's available. There may come a time when people have to reserve their come to church. This way you can be sure of that if you have more than one service, that you are able to spread out the number of people that attend each service. Prepackaged communion, again, really have to think outside the box with how you want to offer these things, not providing things down pews, especially because you're going to be spread out to begin with. There isn't going to be someone on the other side of the pew or even in the pew in front of you. So really, you don't want people having to lean over 3 pews to pass things over to other people. If you're going to keep your restrooms open, make sure that people don't have to touch garbage lids to lift things up to put in. And then everyone, kind of like when you're at a campsite, you pack in, you pack out. You need to make sure that everybody takes away with them what they've come in with, so that there isn't garbage left in the pews for the people that do have to. And then again, you can hold services outside. It does afford you the ability to have more people attend. So other things that you're going to have to look at are, there may not be choirs in your church for a while. The choirs may not be able to sing if you can't distance them. And singing, as we have learned, projects the particles of viruses for anyone that may have a virus and not know it, because there are so many people that have no symptoms of this virus that are carriers for it. So when you sing, your droplets go further. Even if you're wearing a mask, there's still the potential with singing. So you may not have a choir. You may want to have pre-recorded music already playing. Everyone should have the plan and know what the plan is for how people are going to move through the facility. So if you have volunteers or ushers, they should all be well versed in what the plan is and how we clean up afterwards. They may, as I said, move outdoors. Circumstances may allow. It's been a very, very difficult time for anyone having those important milestones or tragic milestones for funerals, for weddings. Religious education classes were all canceled, but things like communions, very difficult time. And once the houses of worship start to open, people are going to want to make up for those important events that they've missed. So where you may see a flood of people wanting to have funeral services for their loved ones that have passed during this time. And it was a very difficult time to lose a loved one. And people are going to want to have those. So we're going to have so many more of them than we would have had at a normal time, because now you're not only going to have the ones that are occurring now, but the ones that have occurred over the past few months, and people are going to want to get together with their families. So we have to have a plan for that as well, for how to deal with the funerals, with weddings that have been postponed and people wanting to get married, first communions coming up that may have been in May that were all need to be rescheduled. So it's going to take a lot of scheduling effort as well to plan for these things, especially under the constraints of the 50 people allowed in the facility at once. And turning people away is a very difficult thing to do for a house of worship. So you need to have a plan for that as well when you do hit capacity. How to deal with that. People are already, so the quarantine has taken a great toll on people, on their emotional and their mental well-being. And so people that are now feel that their house of worship is open may be very upset by the fact that they come to go to the house of worship and they can't get in because it's at capacity. So we have to be cognizant of that as well, and have someone who is prepared to deal with that as well in a compassionate, thoughtful way, other than just, oh, the doors are closed, you can't come to church, because that's and that's hard to say. And if that's a volunteer saying that, to be cognizant of that as well. It's a terrible thing to say to someone, I know you really want to come to worship, but you can't because we're at capacity. That's a very difficult conversation to have, and a very touchy conversation. So you want to make sure that you've discussed with your volunteers as well, so that they're prepared for those conversations as well.
Those are great points, Anne-Marie. I know that some churches are considering actually doing reservations so that people don't actually show up to the door and then are turned away. They've gotten up, they've gotten ready, they've driven, walked, gotten to the church, and now they can't get in. So some churches are looking at reservations, whether on by phone or online, so that people actually know whether or not they have a reservation, and then figuring out how to make sure that everybody gets a chance, or offering enough services to try to make sure that everybody gets an opportunity to come and worship if they want to.
So nursery staggering arrivals and drop-off times. You don't want everybody coming into a facility all at once. Who's watching the children? What's your ratio of adults to children? How do you keep those children safe? How do you keep them in their groups as well? Some of their regulations are that you are a small group, you are in the same group, so that you don't have 20 children all mixing and running around together, that you have small groups and that those groups stay together and those groups stay socially distant from other groups as well. So those are, and not having people congregate to wait to pick up or drop off. Infants should be in their car seats. And then encourage hand washing with children too. You know, we find that kids are very receptive. Make it a game, hand sanitizing or washing their hands, sing songs while you're washing your hands. It makes it fun. Kids like fun. So, you know, encourage that. Encourage them to wash their hands, to stay together in their grouping. It's hard in this time, and children over 2 should be wearing masks. They should have those little tiny, cute, adorable little masks that they wear. And they should, you know, be practicing the same social distancing from the other groups. And that's not easy either. With everyone going back to this, that's going to be very interesting to see how you get a group of children all together to keep those masks on and to not chew them or play with them or twirl them or put them on their feet. So there's a lot of things to take into consideration there as well. And then again, we said the important thing was communication and training. You need to train any staff that you're using or any volunteers that you're using. They need to have the procedures to follow. They need to really know those procedures really well, as well as why we do what we do. Compliance is so much higher when you explain to people why you're doing something and why the necessity for it. Create your written procedures, have them written down so that people can take that and have it with them at home. Make sure that that plan is followed consistently. So if there is a maximum number in that plan, oh, well, this volunteer lets those extra 10 people in, but this volunteer doesn't let those extra 10 people in. You need to follow and everybody use the training, as I said, is very, very important, especially for the cleaning of the facility and using that personal protective equipment and making sure that people are using it. So when they're cleaning, you want to protect those people that are cleaning the facility as well, and they should be wearing gloves and they should be wearing the masks. And we want to make sure that they do that. I know sometimes working with gloves on is cumbersome. People don't like it, but it's oh so important if you are cleaning up after a service that you are using the proper protective equipment and that everybody is trained in that and trained to wear their mask over their nose, over their mouth, so that we don't expose the people that are helping us to anything because they're not following the proper procedures.
Thank you, Anne-Marie. So does anyone have any questions for Anne-Marie or Dr. Ballum? And Kathy, are you on the line too? Kathy's our chaplain, and she certainly weighed in heavily on some of the commentary. If there's anyone that has any questions, feel free to type them in the chat, or hopefully we can hear you if you have any questions for either Anne-Marie or Dr. Ballum.
I think one of the things I just wanted to add to what Anne-Marie said is that, you know, when the hospital is filled with COVID patients, in a sense, it was easier because we knew everybody that came in had COVID. Now, opening up a facility in the hospital to clients and patients that have COVID and those that don't is very complicated. And I think really being thoughtful, planning and communicating effectively are very important to keeping everybody safe that comes into your houses of worship. You know, and I would emphasize really just communicate to the people that are vulnerable, some of the older people that come to the churches and people that have medical issues or cancer, and just, you know, really, you know, be thoughtful of how you allow them. Maybe you have extended hours, maybe you do multiple masses, you know, that way you can minimize the number of people that come in. It ends up being probably a lot more work and a lot more hours. The days are longer. It's no different than our medical offices, you know, in a sense, because, you know, now we do some virtual, some in person, but we do evenings, we do weekends, we extend our hours knowing that we really can't bring as many people in all at once. I hope that was helpful. I hope that brought you some insight. And like Desiree said, I'm happy to answer any questions about the medical aspects of COVID, if you have any.
Hi, everyone. This is Michael Straker. As a physician at Clara and also as a church leader, as a deacon, I appreciate my senior pastor and our musical director for joining us. But this is a great opportunity for us to have this forum. Is the slide show going to be, or the presentation going to be available to us offline so that we can refer back to this? I know our sanctuary is not really planning to come back until after the summer, so we still would want to employ some of these things. If Pastor Beck, I'm not sure if that's true. We're going to want to use some of these tips and techniques even then, but we'll need access to this after this particular presentation.
Absolutely. The recording can be made available as well as the slide deck, so you can access all of the hyperlinks that we covered throughout the presentation. Absolutely, Dr. Stryker. So Kathy, I know that you have some thoughts and insights and some great ideas and considerations. Is there anything that you think we missed that we should mention as far as things that we could be thoughtful of as we reopen?
No, you actually did an excellent job covering everything. I know that our church is having it's called the overflow room, and that's where they're giving seniors an option to go in there, so they're not in the main sanctuary. They're a little separated, and of course it's up to them. It's their option. Like, we don't want to force anybody to be separated unless they choose to, or people with medical issues. Another thing that we're doing is because it's limited, I mean, we have a very, very large sanctuary, but we can only have 50 people in it at a time right now. So what they're doing is they're not only making reservations, they're also having online services for those people that can't get in, because we certainly don't want to turn anyone away, even though the sanctuaries may be full. Some churches that I've spoken with are having easy ups put up outside, or tents put up outside, in case the weather's not so good. And that way, if somebody comes and they can't get in, they can still have the service. They're using radio stations, they're using outside microphones, so they can still hear, even though they're outside the sanctuary. And of course, this all depends on the size of the building and the parking lot and things like that. As far as communion is concerned, they do have the prepackaged communions where there's juice on the bottom and then there's the host on the top. They're not handing those out. They're on the tables to take as you walk in to the church. They're on the table for you to take. They've been sanitized. There's also another option where they're giving these little cups with the lids, and they're sanitized. And then they're taking a piece of bread and wrapping it in cellophane, which of course is all clean. And then the staff is wearing gloves and is standing there to make sure that nobody is touching anything. Like, they can't pick it up themselves. It has to be handed to them by a staff that's wearing gloves. So those are the only other suggestions from talking with other faith community members that I received.
Great. And Kathy, are they doing temperature checks at your church?
Are they doing what?
Temperature checks for staff and for visitors?
Temperature checks? No, not that I'm aware of. Nobody's mentioned that, but I will suggest it.
Thank you. Any other questions? So I did post my email address, because sometimes you may not have questions now, you may have questions later, and I invite you to stay connected. And if you hadn't emailed me already that you'd be attending, just shoot me an email, and then I will reply with a copy of this deck so you have it for yourselves. And feel free to share I see that there have been notifications. I've gotten several messages that there's all kinds of internet outages tonight for some reason. There's a lot of issues going on, so some people weren't able to log in. I know T-Mobile and a few others are having some serious issues. So, but we just want this information to get to the people that need it most. So please do feel free to share. And if you need anything further, we're happy to provide it. And I thank you all for coming and spending this evening with us, and wish you all the best. Thank you so much, Anne Marie, and thank you so much, Dr. Ballin, for your time and for your wisdom and your insights. I greatly appreciate it.
Thank you all. Have a good night.
Thank you, everyone. Great night.
Good night.